Hi, and welcome to Wilderness Medicine, first responder. So, wilderness medicine and rescue medicine, or wilderness and rescue medicine. So, overview: what is wilderness medicine? How did it begin? What does it encompass? Why should I participate? How do I become involved? And can I complete a class? Should be said, how can I complete a class? I suppose. So, what is it? Wilderness is a tract or region uncultivated and uninhabited by human beings. It's medical care in a non-medical setting. That is, you're not going to be going to a clinic, and you're not going to be treating people in a hospital. You're not even going to be treating people in the back of an ambulance. It's going to be outside. Requires a broad knowledge, and I say even a broader knowledge than your basic EMT in the urban setting, because there isn't the ability to get to definitive care quickly. So you're going to have to understand wound care, long-term wound care possibility, especially if you're 3-4 days out and you're hiking back. Hospital, helicopter rescue issues, all those type of stuff you're going to have to know. So broader knowledge is required, and it encourages adaptation and creativity. Be flexible. Semper Gumby, as we used to say in the Marine Corps. You need to be flexible. So how did it begin? Well, the earliest human medicine was wilderness medicine, right? I mean, think about our settlers over here when they came, the Pilgrims, for instance, or the American Indians, or all those, the all the way back to the cave people that were taking care of people. It was wilderness medicine, right? What we had on hand. It used to be called frontier medicine back in the day, after we started settling in the East Coast and we started moving forward. So that is what wilderness medicine really is. In the mid-70s, physicians and guides, outdoor guides, started meeting to discuss what to do in a mountain medicine setting. And those are the topics that were discussed. And obviously it moved forward, and the Wilderness Medical Society was created in 1983. And then in 1990, the first edition of Wilderness and Environmental Medicine was published. It's a really good magazine. I really encourage you guys to join the Wilderness Medical Society, and you get that magazine with your membership. Wilderness medicine interest has grown every year, and it's growing even today. And this is why you guys are in a class, right? And wilderness medicine has expanded to a subspecialty area, so physicians can actually get a fellowship and become certified as a wilderness medicine expert. So these are the type of clinics that you're going to be working with. If you're, this is Himalayan, so you go over there. This is where you're going to be sending people to. This is the best that it gets out in a wilderness setting. So what does it encompass? Mountain medicine, disaster medicine, marine medicine, meaning ocean dive rescue type of stuff, tropical medicine, tactical medicine, international travel, search and rescue. So if you take a look at the photographs over on the right, you see some doctors working on some patients in a tent. That's kind of like what we did when I was a corpsman serving the Marines. This is what our clinic was the tent or back of a Humvee or whatever, right? There's some sort of search and rescue, or looks like possibly a cave rescue or cliffside rescue going on over here. And so that's another option. Look at what they're working with. They're in the dark and they have headlamps on, and that's what you're working with. You're not in a clinical setting by any means. Wilderness medicine topics. Altitude disorders, right? We discussed that. If you've taken the wilderness first aid class, we talked about high altitude illness and how it can go on. There's the gamma bag right there. It's a really cool picture of them using that. Cold injuries and heat injuries for that matter. Hypothermia and hyperthermia. Emergency airways. Evacuation techniques. Dive medicine. Lightning injuries because you're exposed. It's kind of hard to hide sometimes, so there are a higher probability of getting hit by lightning. Wilderness trauma compared to your tactical trauma, that too for that matter, but wilderness trauma compared to your everyday car accident type trauma. Envenomation, whether it's from bee stings or bites from poisonous snakes. Field dentistry. We touch on it a little bit in the first aid, but this is going to go a little bit deeper. And then survival physiology, and then plant toxins and dermatitis, which is such as like your poisonous plants, such as poison ivy, poison oak, poison sumac, so forth. So how does the class work? First, you need to read the lesson in your book. Second, listen to your lecture, because you will get a lot of information during the lecture, and we will go through that. contribute to the forum. So ask questions, because if you have a question, somebody else probably does, and there are really no bad questions per se, and we'll discuss them all. Pass the test. And you can listen to this lecture, you can look through your book and pass that test. And you're going to have 6 tests throughout the thing. And each one will also encompass the other course, so it's not just on that chapter. So you have to really pay attention to what's going on here. I want you guys to really understand. Now, and then take the field practical. And that's the really important one right there, because if you could do it in the book, but if you can't do it in the field, it's really useless to you. So pass that field practical. So what are your training opportunities here? Well, Wilderness Medicine Conference, every year they have a couple of them going around. And you just take a look at if you're part of the Wilderness Medicine Society, you can see the conferences. Advanced Wilderness Life Support, and that's a really good course to take too. It's like ALS here in the civilian side, in the urban setting, but based on obviously in the wilderness. And then WEMT field training days. And as an alumni of this organization, you can come to any of our field training days and participate. And we might even have you do some skills testing, basically because my philosophy here, and it's also something in adult education, is you learn through the book, you learn by doing, you learn by watching, and then you learn by teaching. And I think it's really, and I learn a lot every single time I have a class, because people take a new perspective at the way to do things. And that's one thing I really encourage you guys to do, is learn and think of it different ways and come at a different approach, because I've been doing this stuff for a long, long time, and I kind of get stuck in my ways sometimes. But you guys come over with a fresh view of things, and you can go, well, look at it from a different angle, and you really learn that way. And I'm always learning as I teach, so I love it. That's why I like doing this. So, wilderness medicine is a broad field offering countless exciting opportunities, whether it is your expedition medicine, or if it's just going out camping and hiking with your friends and family, and that you can help them if they happen to get into trouble. There are multiple ways to get involved, whether it be through the Wilderness Medicine Society, through the forums, through clubs, through joining search and rescue teams, whatever, that type of stuff. And wilderness medicine training helps all levels of medicine. And I think, like we talked about disaster medicine a little bit here during our, what can you use wilderness medicine for? And it is really true, because with wilderness medicine and the disaster medicine, it's about definitive care. And, so that's why we actually teach this to a lot of our CERT members, our community emergency response team members will take wilderness medicine first aid to help out with that. And get out there, have fun, and enjoy the outdoors. So that's really important. So thank you for being here in this class. I think that we're going to have a lot of fun learning together. And, especially when I see you guys out in the field and doing our field training days, and that's where it's always a lot of fun. So if you have any questions, feel free to email me at admin@wemt.org. You can call me on the phone number that's posted, and you can hit me up on Facebook with the WEMT site. And so anyway, looking forward to it. You guys have a great day. See you at Chapter 1.